Hi, I'm David Shearman. This is part of Rogers COVID-19 special programming. We're interviewing Dr. Ian Arra, the Medical Officer of Health for Grey Bruce, as we have for several weeks in the past, and we will continue to do so. Dr. Arra, welcome. Good to have you here.
Good morning, David. Thank you for having me.
Now, this week has started out a little bit differently than previous weeks. We seem to have had a run of no cases of COVID-19, and then all of a sudden, boom, we've got 3 cases. And I think there was one earlier over the weekend, but we've got 3 or 4 sitting there now that are new cases. What's behind that? Is this just a speed bump?
So yes, there is an increase in 3 cases, but if you look at the bigger picture, there is no change in risk. The day before or the day after, there is still community spread. We need to be cognizant of the fact that many people say, we're done with this virus. Well, this virus is not done with us yet. We're not out of the woods yet. We have done amazing to have the astonishing results that we have in Grey Bruce. And that's, tremendous effort for social distancing, for physical distancing, for everybody to do the right thing around the table. But the risk still remains. And we are working towards successful reopening. A key component of it is the awareness that the virus is still here. It's community spread. The risk still remains similar to a few weeks ago. And it's not the time for any of us to lower our guard. We need to go into the reopening stages and go about it very careful, more careful actually than the months of April and May where we had social distancing taking care of us. Right now we need to go back to the workplace, and doing this we need to learn all the new habits of how to be mindful, how to be responsible, to have successful reopening.
And that's going to be the next big question that we're going to have to deal with, and that is the next stages of reopening. I gather that that's taking a lot of your time right now to kind of put things together, to bring best practices together. I've noticed on the Health Unit webpage, there's more guidance for people to look at, and very interesting presentations there.
Yeah, the reopening stages of any pandemic recovery stage is way more work than people usually are aware of. And it's essential to go with the underlying principle. The goal forward is to balance the disease from COVID versus a disease related to COVID response measures. More specifically, we know that the disease is going to cause some cases, hopefully no death, but we know that the social and physical distancing measures that we have in place would contribute to more disease and potentially death related to different factors, whether related to mental illness or domestic violence or heat waves. We all know our summers have heat waves where the less affluent of us might not have the ability to have air-conditioned environment, and they usually depend on cooling centers, on grocery stores, schools, and these locations that would provide the cold environment. In the middle of COVID, this is going to be very challenging. And we know if we don't provide these services, heat will cause death. And the main factor in that equation is income. Income is number one social determinant of health, guaranteed. If you Google any public health organization to look for social determinant of health, what determines the health of the public, you're going to find a list, top that list, guaranteed it is income, because how much a person makes and how much income comes to them would dictate how much health they have. So going forward, if we just ignore the fact that businesses require reopening to stay afloat, to provide income to our community, we might end up with more disease and death related to loss of income than disease related to COVID. And that's the underlying principle in reopening. And that's why public health is very involved in making these reopening plans more safe. We work with the two counties, with the municipalities and local businesses. And for example, we have two webinars lined up next week to have information provided to businesses how they can modify their activities to hit the ground running when they get the green light from the province to open. And that's a lot of work on everybody around the table. Every business has, every subsector of businesses have different activities, and each business has different local need or specific need to their business, to their location. So working with everybody to have plans that would provide safety to the workers, to the public, is what we have been busy with for 4 weeks and will be busy with going forward as well.
I happened to hear a presentation on the plans or the practices that one of our biggest employers in Sound Transcontinental is doing in their plant to make sure that their workers are safe, to make sure that everyone is able to work safely. And they've made some major and quite astonishing shifts to their practice, their work practice, the way they do, the way they conduct their printing business, even their lunchroom has been modified for best practices to make sure that everyone is safe and is protected from COVID-19.
Yeah, that's definitely what we've been seeing with different businesses. They have been very responsible, proactive, trying to do the right thing for their employees and the public, and eventually for the most vulnerable of us, the older adults, people with comorbidities, because this virus really does not discriminate. It's just going to go through as soon as it finds an opportunity to transmit. The other things that public health agencies do around reopening is the preparedness to identify new cases and nip it in the bud before becoming a cluster or an outbreak. And we do have the capacity to identify the sensitivity of the surveillance system to pick up cases as early as 5 minutes after the lab identifies the test. Then the other equation, part of the equation of this, is the capacity to have contact tracing and case management and contact management. So any case we identify, we again I mentioned many times before, we contact these cases immediately and their contacts, and we find where they have been in the past few days when they were potentially spreading or shedding the disease, and contact everybody who they might have came in contact with. And we have been able to maintain 100% follow-up within 24 hours. The provincial target is 90% of all cases and contacts should be contacted within 24 hours. In Grey Bruce, with the cases we have and the contacts we have, we've been able to do it 100% with every case within 24 hours. And it's worth mentioning, yes, we have 90 plus cases, but the number of contacts generated from these cases is in the hundreds. And we have been, we have the system, we have the training to provide the service and to reassure the public, even if the numbers of cases went up way more than what we have been seeing, there is the capacity to depend on Public Health Ontario. They have a group of volunteers, mainly medical students and retired healthcare providers, and they will be able to provide that service to support us with it. So far, we have not needed this service unless, sometimes you would find some contact tracing related to different language, somebody who speaks Spanish. So it's easier to find that service with Public Health Ontario. And all in all, we are in a really good position and readiness for reopening that is safe and responsible.
One of the things that many people have said, these experts in this area have said, is contact tracing is absolutely critical. It sounds like you feel very confident in the ability for the health unit to do the necessary contact tracing.
100%. This is where we earn our credit, and this is not new. It's novel virus, but we do this for salmonella. We do this for hepatitis A. We do it on daily basis throughout the year. And there is a COVID team specifically for COVID My direction is to have the contact as soon as possible. And if it's related to long-term care or retirement home, it would be within minutes. I'll be communicated as soon as we receive the communication about a case, positive case in long-term care. My direction is to be called immediately, no matter what time of the day or the night. And our team will be on the recommendation for social distancing, for isolation, and all the other protocols that we implement within minutes. This is something we don't take very lightly at all.
It sounds like that's public health's version of the fire alarm bell.
You can say that again, absolutely. And again, public health does not become the center of emergency that often. So people know that emergency is related to fire, police, EMS, but public health is definitely trained and organized, orchestrated to provide support during emergency. And this is, an emergency of a caliber that comes once every 100 years. And again, we are prepared for it. We have been prepared for it before it even hit the news here that this is a community spread or so. In January, I presented to the board, and in February, I asked the municipalities and the two counties to dust off their pandemic plans. This has been, on our radar. We've been preparing for it for months now.
The local mayors, the local municipal politicians have expressed concern over the upcoming summer vacation season with an influx of people from outside of the area. Do you share a concern about that, or do you feel that things are well in hand?
Definitely there is concern about it, and concern is not a negative concept. Am I worried about that? I'm not worried. There is definitely a need to look ahead of the weeks to come to see what we can do and how we can be prepared. That's a better practice. Instead of being reactive, we need to be proactive. And all along, we've been looking at the potential increase in risk in people arriving to the area with the opening of the season. However, all along, we've been able, as a group, as public health and mayors and police chiefs, fire chiefs, all the stakeholders around the table, we've been able to manage successfully through every encounter we had, every juncture we had. And the numbers that we have today speaks to the ability of all of us to collaborate and provide the response needed with every juncture. So going forward, I know people are going to be arriving, and we would have the communication that we had already with our local residents, with the cottagers who arrived. And all along, we have seen that the number of cases have not increased significantly with any new arrival. And I don't expect this would be different going forward. If there is quite the influx in number of people, we would increase the recommendation. We might up the recommendation to an order to mitigate whatever risk there is. For example, recently, with the opening, the start of the summer, there's always the anxiety of having gatherings on beaches. And that's where we moved to an order to close beaches for 2 weeks. We did not publicize the 2 weeks period because we really wanted to send a message that we're not open for tourism yet. And at the end of the 2 weeks, each municipality would have had enough time to pass their own bylaws if they need it, and they will implement it as they see fit. And again, we're monitoring the whole area. So if there is need for more recommendation, whether with the arrival of new people during the summer or any other event, we will be very responsive. We are going to be proactive to actually anticipate these things and deal with them.
That sounds like it'll be a very different summer. That's going to be one thing for certain. It'll be a very different summer.
It is a different reality, David. Like, few weeks ago, few months ago, we're living our life. Now it's a different reality. And again, this virus is not done with us yet.
Well, I guess that means you and I are going to be having more conversations over the next little while, Dr. Arra, because we're just about out of time. I wanted to thank you for your time today, and we'll let you get back to the important work that you're doing. Thank you very much, Dr. Arra. I'm David Shearman. This has been Rogers' special COVID-19 programming. We'll see you again.
Thank you.
Due to the length of the preceding program, we now join the regularly scheduled program already in progress.
The shoreline. This was deceptive and inaccurate. Over 200 residences are in this potential flood zone, and hundreds of people at risk are counting